Hi. So, in previous session we have learnt about the fungus, and we have mainly learnt about that how our innate immunity take care of fungal infection. Okay. So, in this session we will discuss about again we will take this topic in more detail, means in which individual this fungal infection is more prominent, and then we will discuss about the some list prepared by the WHO. There are different level of or there are some fungus which is quite dangerous, some are less dangerous, and some are not so dangerous. Okay. And we will also discuss about the two fungal diseases which is caused by Cryptococcus neoformans and Aspergillus species. Okay. So, let us begin this. So, there is a invasive fungal diseases by fungal infection, and the fungal pathogen are associated with people who are risk due to underlying health problems. So here I want to say that many individuals or in society there are many people who has some or other diseases. Okay, they have some other health problem. Mainly the health problem are associated with this metabolic in nature. The diseases associated with metabolic disease are like this is diabetes, hypertension, and to some extent cardiovascular diseases. Okay. So, those individuals are at or those individuals are more prone to the this kind of infection. Okay. Weakened immune system, as I have discussed in previous session, some individual has some congenital problem. Congenital problem may be, if you remember my previous session, I have discussed about there are some individual who has a deficiency in functional neutrophil. Okay, there is a impaired ROS production due to mutation in NADPH oxidase. Okay, if you remember that session. Okay. So, weakened immune system such as chronic lung diseases, pre or tuberculosis history, if individual is having some pre or tuberculosis history, individual who are infected with human immunodeficiency virus, individual who had cancer or diabetes mellitus. Okay. So, these individuals are more susceptible. So, diabetes mellitus and all these things are metabolic diseases. Okay. Critically ill patient in intensive care unit. So, individual who are in intensive care unit, patient undergo invasive medical procedure and receiving broad spectrum antibiotics. So, too much antibiotic is also not good. Okay. Broad spectrum antibiotic, and those taking immunosuppressive medicine are also at the risk. So, you can understand the individual who is undergoing major surgery, generally major surgery is taking place when there is a organ transplant. Okay. So, during organ transplant this is a major surgery, plus those individuals are kept over the immunosuppressive drug. Okay. And this cause this basically cause two layer complication. One is major surgery, another is immunosuppressive drug. So, these individuals are highly prone to the fungal infection. Who are at risk, it is a rising as risk population continue to expand due to following reasons. So, advancement in modern medicine and accessibility to the therapies. Okay. So, these days people very quickly take any medicine, so that is also not good. Okay. That may invite the fungal infection. Okay. Or some kind of therapy, right. Individual is having allergy, and those individual can quickly take some maybe some steroidal molecules or drugs which can basically suppress the immunity. So, that those individuals can be prone to the fungal infection. Intervention that impair the immune system, such as chemotherapy, immunotherapy for cancer, and solid organ transplantation. Okay. So, these individuals are as I explained you, they are highly susceptible to the fungal infection. Patient with chronic obstructive pulmonary disease, okay, or patient with liver or kidney disease, viral respiratory tract infections such as influenza, and those with prior non-tuberculosis mycobacterial infection. So, these individuals are also highly susceptible to the fungal infection. Probably you may remember one disease which is quite prominent worldwide after the COVID, or not after the COVID, during the COVID. Okay. So, the COVID or coronavirus disease pandemic has been also associated with an increase in incidence of comorbid invasive fungal infection. Okay. And if you remember, there are three groups of COVID-19 associated fungal infection. One is Aspergillus, okay, and there is a mucormycosis. Mucormycosis is that black fungal disease. It's a very well reported in various news channels and all those resources. Okay, so this mucormycosis is also associated with this COVID-19 infection besides Aspergillus, and there is also candidemia. Okay, there is a presence of candida in the blood. Okay. So, these are the here you can see very good association between the fungal infection and other diseases. Okay, this viral disease are associated with fungal diseases, and this mucormycosis is a quite dangerous disease. This has a this infection can take place in various places. It can take place in the brain, it can take place in nose, it can affect the lungs. Pulmonary mucormycosis is also there, and this can affect the central nervous system and various organs. Okay. So, this is quite dangerous disease. Finally, there is evidence to suggest that both incidence and geographic range of fungal infection are expanding globally due to climate change. So, this fungal infection is also associated with the climate change. So, there are some dried places, but those places are receiving too much rain, and so all those things that will increase the humidity, and then that will make the individual prone to the fungal infection. So, fungal infection were enhanced due to rapid emergence of antifungal resistance. In many settings, limited access to the quality diagnostic and treatment. Okay. So, generally the fungal infection detection is a little or diagnosis is a little complicated, and it is not so common. Okay. So, that is why the treatment is not very effective. Okay. So, these are the another reason. So, antifungal resistance has a major implication for human health. It generally leads to prolonged therapy and hospital stay. So, do not underestimate the fungal diseases. Fungal diseases are more complicated to manage. Okay. Here, this is a I want to talk the WHO made some kind of list, and this is a WHO fungal priority pathogen list, and this is a critical priority group. So, these fungal like Cryptococcus neoformans, Aspergillus fumigatus, Candida auris, and Candida albicans. So, they are very critical priority group. So they are quite dangerous fungus. Okay. So I will talk about the Cryptococcus neoformans and Aspergillus fumigatus, the disease caused by these fungus. Okay. So Cryptococcus is caused by Cryptococcus neoformans. So overall, approximately 1 million new cases of Cryptococcus occur annually, and the mortality is approaching about 50%. This is a quite frightening number, right? It's a quite high, right? 50% people die by fungal infection. It is really quite a point of worry. Okay. Cryptococcus neoformans is the key pathogen which can cause this disease. Besides this Cryptococcus gatti occur worldwide in nature and is isolated readily from dried pigeon fishes. So here please note that this fungus is coming from pigeon fishes. Okay. So they basically harbor this Cryptococcus neoformans. Okay. As well as a tree, soil and other sites are also there, but be careful with pigeon. Okay. From lung, these neurotropic yeast typically migrate to the central nervous system. So they are basically not only affecting the lung, they are reaching to the central nervous system where they cause meningoencephalitis. Okay, they basically cause the inflammation of meninges. Okay. They can also have a capacity to infect many other organs. They can infect the skin, they can infect the eyes, they can infect the prostate. Okay. So this fungus has a quite well developed potential to cause a very dangerous disease. So now you can understand it is not surprising that about 50% people die if they have this infection. Okay. So Cryptococcus neoformans occur in immunocompetent person. So please note this infection can be also present in the immunocompetent individual. It's not only associated with immunocompromised individual. Okay, but it is quite often, or it's more readily associated with patient with HIV. Okay, or hematogenous malignancy, it's a blood related cancer, and other immunosuppressive condition, generally the individual who receive this organ. Okay. So they are on immunosuppressive drugs. Okay. So here I am just presenting the life cycle of this fungus. Basically here you can see that this fungus is coming from pigeon feces, this Cryptococcus neoformans, and this is basically inhaled or inhalation of this desiccated yeast, okay, to the pulmonary alveoli. This can also come from the trees. Okay. And basically it affect the lungs. There is a phagocytosis by alveolar macrophages, and then there will be a resolution or latency pulmonary diseases and or spread to one or more sites. They can affect the brain, and this will cause the wide range of pathology. Okay, not only brain, then it can infect the skin and so on. So here you can see this Cryptococcus which is depicted here. The capsule of Cryptococcus neoformans is notably apparent in the pulmonary lavage specimen. Okay. Now I will talk about the another fungus, that is Aspergillosis, which is caused by the Aspergillus species. Okay. And this basically this is caused by Aspergillus species, and Aspergillus fumigatus is one of main pathogen. Okay. is most common human pathogen, but many other including Aspergillus flavus, Aspergillus niger, there are various species may cause the disease. Okay. This mold produce abundant small conidia that are easily aerosoled. So, this can easily go in the air and then individual can inhale and then they can suffer from the aspergillosis. Okay. In immunocompromised patient, especially those with leukemia, the patient who have this blood cancer, leukemia, or a stem cell transplant patient, an individual taking corticosteroid. So, here you can see that corticosteroid is basically a immunosuppressive drug. Okay. So, those who are regularly taking this corticosteroid, the conidia may germinate to produce hyphae that evade the lung and other tissues. Okay. In the lung, alveolar macrophages are able to engulf and destroy the conidia. However, macrophages from the corticosteroid treated animal or immunocompromised patient have a diminished ability to contain the inoculum. Okay. In the lung, conidia swell and germinate and produce a hyphae that have a tendency to evade pre-existing cavities, and then there will be a aspergilloma or fungal ball will be formed, or it will also present maybe in the blood vessel. Okay. Here this is a Aspergillus fumigatus image. It is recovered in the lung tissue, stained with some particular fungal staining agent, that is gomori methylenamine silver. Okay. This is a high priority group. These fungus, as you can see, that there is a histoplasma, there is a mucorale, the Candida tropicalis, there is a Candida paraphylosis, Fusarium species, Eumycotoma causative agent, and there is a Nakasimomyces galbarata. It is a kind of a Candida species. So, this is a medium priority group. Here you can see that Cryptococcus gattai, there is a Talaromyces, Pneumocystis, Paracoccidis, Pichia, Coccidioides, and there are some another fungus. Okay. So, these are all this fungal list which is prepared by the WHO. Okay. And this is not so dangerous compared to the previous one. So, with this I am finishing all fungal diseases or about the fungus, and in next session I will talk about the parasitic infection, and that will be the last topic for this course. Okay. Thank you.